Okay, hello. So my name is Melanie Elhaddad, and the topic that I have chosen for my presentation is the use of hypnosis in counseling. So to begin, the Division 30 of the American Psychological Association defines hypnosis as a state of consciousness involving focused attention and reduced peripheral awareness, characterized by an enhanced capacity for response to suggestion. There's, of course, a debate about whether it is a heightened state of attention or an actual altered state of consciousness. But there is a general consensus that it is characterized by an enhanced capacity for response to suggestion. Hypnosis is as old of the field of psychotherapy itself. Freud actually used hypnosis as a therapeutic tool to access the unconscious mind, retrieve repressed memories, and allow patients to have catharsis about traumatic memories. There's a theory that when you experience a traumatic memory under hypnosis, you will have a sense of catharsis about it. So that is where he used it. He further believed that you could actually increase the accuracy of memory retrieval in certain states of hypnosis, but he eventually felt that hypnosis was too difficult to control and too unpredictable, and therefore abandoned it. The role of the counselor in hypnotic oriented counseling is as a facilitator who facilitates the individual for the purpose of solving problems by using subconscious language such as positive suggestions that can motivate individuals to change. Behavior change can occur if it is carried out directly at the level of the individual's subconscious mind, because the subconscious mind understands reality based on real experience and can influence as much as 88% of an individual's life. Hypnosis is generally used as a supplement to different types of therapies in the treatment of disorder or pain. Hypnotic oriented counseling views that humans are individuals who are intelligent, rational, creative, and have the ability to solve and find problems to the problems to find solutions to the problems they currently have. So we're going to talk about the use of hypnosis in the treatment of a few different disorders, specifically post-traumatic stress disorder, major depressive disorder, and how it's used in the treatment of social media addiction. So we're going to start with PTSD. When hypnosis is used in the treatment of PTSD, it's used generally as a supplement to cognitive behavioral therapies. So a little bit about PTSD. Symptoms generally fall into three categories of either re-experiencing events, avoidance of stimuli, or persistent state of increased arousal. So this trauma, of course, generally varies very widely between individuals in scope and format, and hypnosis has to be adjusted based on the individual's current state. But hypnotic treatment allows modifying ownership and agency of these traumatic memories, and it is often embedded in a three-phase oriented approach in which three elements need to be timed sequentially. These three elements are symptom stabilization, exposure, and finally closure. Hypnosis, particularly when used as part of an ego state therapy, it targets PTSD by allowing the fullest expression by the traumatized ego state while providing the needed recourse to respond to the threatening agent. Hypnosis is a powerful contribution to the treatment of PTSD, which makes it the treatment of choice by very experienced clinicians. When hypnosis is used in the treatment of major depressive disorder, generally it consists of 16 weekly sessions, which can be expanded or modified according to the patient's clinical needs, areas of concern, and presenting symptoms. A little bit about major depressive disorder. It's characterized by feelings of sadness, a lack of interest for enjoyable pursuits, sleep and appetite disturbance, a sense of worthlessness, and thoughts of death and dying. So an example of how hypnosis may be used in therapy is, for example, a person may explain they were depressed at a party last week. They are then put into hypnosis and regress back to the time of the party while under hypnosis to try to identify unhealthy or depressive cognitions. It's generally used to integrate CBT and hypnotic strategies to address non-conscious schemas. It can also be used in a self-guided way For example, the individual may be given a CD with positive mantras that they would listen to in a self induced hypnotic state. So, for example, the CD may say, while you are in an upsetting situation, you will become more aware of how to deal with and rather than focusing on your depressed feelings. Or it may say, when you plan and take action to improve your future, you'll feel more optimistic about the future. And because the individual is in a heightened sense of suggestibility, these mantras will be encoded into their subconscious mind, and thus it will affect their behavior. So finally, hypnosis is also used in the treatment of social media addiction. Shugara and Fadila did a study, including teenagers who were compulsively using social media, and they found that compulsive behavior in social media will lead young people to experience social media addiction. Social media addiction is a behavioral disorder, and hypnotic oriented counseling is a technique that can be used to overcome these behavioral deviations. The utilization of hypnotic conditions by providing positive suggestions to modify negative behavior and foster self control abilities in using social media. The purpose of hypnotic oriented counseling is to empower and foster a sense of mastery and self control in using social media. So there are some cultural and ethical considerations when using hypnosis in therapy. Some cultures may view hypnosis as too passive, that you're not engaging in your therapy enough. So these collective cultures that believe in taking the whole individual and taking the whole group, that you have to engage. And take responsibility for your therapy. These cultures may view hypnosis as too passive. So, some ethical considerations is that individuals may not understand the implications or the power of hypnosis, and they may agree to it without really understanding what they're signing up for. They also may go into a deeper state that they originally wanted to, and they may feel too controlled by the therapist, or they may feel that the therapist has too much of a responsibility on their therapy. So, in conclusion, research has shown evidence that post hypnotic suggestion can elicit striking changes in the perception and behavior of unhealthy thoughts and disorder. Hypnosis provides a powerful vehicle whereby cognitive distortions below the level of awareness can be explored and expanded, and hypnotic uncovering and restructuring procedures can also be used to explore and restructure negative schemas. Clinical hypnosis has clear benefits in psychotherapy, and it can improve outcomes in areas such as pain management, anxiety, depression, sleep, and more. Thank you.